Hi, my name is Bowne-Fitzherbert and I chose to do my project on the opioid epidemic in the United States. Right now, the opioid epidemic has evolved into the nation's most urgent and complex public health crisis. Starting with the history of this epidemic, it initially began as a well-intentioned effort to treat chronic pain, and it has unfortunately expanded into a nationwide misuse of opioids, which has caused a surge of addiction, overdose, and death. In the United States, opioid-related overdoses have become the leading cause of accidental deaths, unfortunately surpassing motor vehicle crashes. Research from the CDC has shown that prescription opioid sales in the United States has quadrupled from 1999 to 2010. And between 2009 to 2019, the nation's drug overdose deaths per 100,000 people nearly doubled, increasing from 11.9 to 21.6. As this has been ongoing, people have continued, unfortunately, to die and overdose and misuse these opioids. Initially, the CDC began to classify this crisis as a three-wave crisis. It first started off in the 1990s with the rise of misusing the prescription opioids. A large population became dependent on their prescriptions, and when these guidelines and restrictions became a little bit more strict and they weren't able to access what they had previously been using for their pain relief, they turned to cheaper substitutions such as heroin, and with the rise of heroin in 2010, it rapidly grew, as did the heroin-related overdoses. In fact, in 2015, heroin unfortunately became responsible for the highest overdose deaths. However, when drug dealers and sellers found there was a market for illicit substances, they wanted to exploit that market. They found that they were able to mix heroin with fentanyl, and it would be cheaper for them, it would be more potent for the people that they were selling it to, and it was easier to smuggle places. So there are a few reasons why there was a transition seen from heroin to fentanyl, and it was unfortunately the price cost, the potency, things of that sort. And then in 2013, then we see this wave consist of overdose involving use of synthetic opioids, specifically fentanyl. Fentanyl was a key component into the climbing deaths, unfortunately, which in 2023, fentanyl was responsible for approximately 199 deaths every day. This is for the total year about 70,000 people, over 70,000 people alone that died from just fentanyl that year, bringing us into mortality and morbidity. Unfortunately, has drastically increased over the past 2 decades throughout those 3 waves. The mortality rate between 1990 and 2020 quadrupled as a result of the expanding availability of opioids and the increasing potency of these illicit substances. In 2025, there was a study of opioid-related overdose deaths, and this was specifically amongst the youth, ages 0 to 19. Over 8,986 children had died from prescription and illicit opioid poisonings. It just goes to show that children were not exempt from this crisis, and unfortunately were also a part of the people who had died. There was also an overall pediatric mortality rate of 268.2% increase between the years of the 1999 and 2016. According to a report from the Stanford Lancet Commission, moving forward, it's projected that 1.2 million people in the United States and Canada will die from opioid overdoses by the end of the decade, and this is in addition to the 600,000 people who have unfortunately already died since 1999. Now, this is to occur if urgent intervention does not happen. There are some social determinants that play a huge role into these opioid misuses and overdoses. Areas that are poverty-stricken and suffering from economic distress typically show the highest rates of opioid misuse and overdose. Much of the country, counties with the lowest levels of these social capitals will have the highest rates. Initially, it did affect white, rural, suburban communities when it first started with that wave of prescription overdoses. However, racial and ethnic patterns over time were seen to have shifted. Recent research actually shows a significant increase in opioid mortality amongst Black and Hispanic communities, especially those with large economic disadvantages. The mortality disparities in American communities study had conducted a nationwide research, and this study happened to find that those, again, with a lower socioeconomic status, again, had a higher risk of the opioid overdoses compared to those who were in a better financial standing. So it just goes to show that more often than not, it does affect those of lower income. And these, again, would cause issues with access to health care, unemployment, lack of public transportation, certain living conditions. You know, if you don't have a house, you don't have a place to store your medication properly. All of these things could drastically widen the disparities that are seen amongst these groups. It's very troubling how it is also seen over time with these shifts, specifically American Indian and Alaska Native people have had the highest rate of deaths in 2021. Again, Black communities and Hispanic communities have also unfortunately struggled with the opioid epidemic. In 2020, Black males were 1.5 times more likely to die of an opioid overdose than white males. So once that racial and ethnic shift took place, unfortunately those of minorities were affected. Overdose death rates for older Black men were also nearly 7 times as high as those seen in older white men. I don't know if this is going to show it properly on the screen. Here you can kind of see a graph of the drug overdose deaths per 100,000 people. Right here we have the ones relating to January between in 2018, January 2019, and January through September 2020. Each of these have an increase in that orange bar, so you can see them increase. We have mortality rate that has increased most rapidly in Black, Native, and Hispanic and Latino Americans. Black, unfortunately, by 249.3%, Native Americans by 166.3%, and Hispanic Americans at 171.8%. On here you can also see the Asian area where it has been impacted, and you can also see the Alaskan Native impact where it had drastically gone up throughout those years. Over here specifically as well, you can see that drastic increase, unfortunately, in that overdose death rates. Some cultural differences and stigmas could significantly impact how these cultures interpret, experience, and respond to the opioid epidemic. There's various cultural lenses and social lenses that play a part. There are some communities where if they have a history of systematic discrimination and distrust of medical institutions or have received unfair treatment, they may be less likely to seek or receive the treatment that is needed and the help that may be required. Specifically, I found that it was alarming that research has shown in the United States, 78% of Americans believe that people who are addicted to prescription opioids are themselves to blame for the problem, and 72% of Americans believe that people addicted to prescription opioids lack self-discipline. This just feeds into that stigma, which again is very harmful. It can make it significantly harder for people to want to get help when they feel as though people are going to assume that they might not want to choose their behavior, or if they feel like they're being discriminated against, or they already aren't believed in to a certain degree. Addressing the epidemic effectively, it requires more than just restricting prescriptions and prosecuting its users. The issue really needs to be approached in a way that acknowledges and addresses the structural factors, such as poverty, the geography, the disparities that we've listed, the limited opportunity in education, the support services need to be increased. Addiction is a disease that is preventable and treatable, and these stigmas only continue to hurt those who are suffering. Moving forward to our solutions and how to seek help to reduce the amount of opioid-related deaths and injuries, solutions need to be equity-centered and address the issues across different communities and cultures where people are being affected more heavily than others. They need to be targeted towards mental health support and improving access to health care, harm reduction strategies. There are medicines such as naloxone and the test strips where you can test for fentanyl, and these substance use treatments that significantly reduce and overdoses and save lives. Specifically, I found that it was interesting that in some cities, even as close as Baltimore, for example, there has been a 5-pillar strategy that's been introduced to try and work as a community to address the opioid overdoses that are happening. And some of these pillars include administering the naloxone, which helps prevent the overdoses when you start to see them occurring. It increases access to on-demand treatment, fighting the stigmas through education, aiming to prevent and stopping substance abuse, and investigating data and trends that increase the quality of life. Just to give thoughts and reflections on the opioid epidemic, I did find some hopeful data and research. I wanted to include something that was a little bit more current. Going through those 3 waves, I feel as though the nation has seen a really rough data with the deaths and the overdoses, and it really struck the country in a negative way. However, in 2025, we are starting to see a decline, which is a promising sign. There's actually been a 27% national decline in drug overdose deaths. And this is the largest one-year decrease ever recorded, which hopefully signals a pivotal moment in the fight against opioid epidemic. Experts suggest that the response to public health needs increased availability to naloxone and improved access to the treatment for substance use disorders, such as, for example, the medication-assisted treatment have all helped towards this decline in overdoses. I think it's important for people to not brush those who are suffering with addiction off as maybe, unfortunately, junkies or addicts, or just see them as lost causes. Unfortunately, you never know what someone has gone through to put them in a situation where if they have chronic pain and were given a prescription and this is what was helping them and they truly just want the pain to go away, to keep sourcing a medication or a prescription that would help them and find alternatives to that. It is good to know that there is a decline starting to occur, and I think it's definitely something that needs to continue to happen through the proper address and an acknowledgement of the root causes of the issue. These are my credited sources for all of the percentages and data and research that I had included. I appreciate your time. I did go a little over. Oops.